Hi, this is Tony with bariatrictv.com. I'm talking to Dr. Scott Shikora, the president of the ASMBS.
ASMBS, the American Society for Metabolic and Bariatric Surgery.
So why don't you tell me a little bit about the society?
The society is a multidisciplinary group of clinicians and researchers whose mission is to provide the very best care for patients with weight problems. And also we strive to prevent obesity. So we'd like to set up programs that prevent children and young adults from becoming severely obese as they get older.
As a patient, what should I know about the society?
Well, that if you are seeking treatment, and the clinicians, and in particular if you're seeking surgery, that the surgeons are members of the society and that also are either currently centers of excellence or applying to be centers of excellence, because that would be a guarantee of the best possible care that we can provide. Obesity is a complex disease. It's not like having gallstones and you take the gallbladder out and you're cured and that's the end of it. This is a lifelong therapy. It's a genetic disorder, and it doesn't get better just because we do surgery. The surgery is really just a tool, and success occurs with long-term follow-up and participation, and for the patient to remember that the surgery is only one small component of everything, of the total care package.
Is there any new developments on surgery types or procedures?
There is a lot going on. If you look at the mid to late 90s as major advances in bariatric surgery because of the introduction of laparoscopy, which is minimally invasive surgery, and also the band, which is a minimally invasive procedure, I believe we're on the cusp of the next great revolution, which are even less invasive procedures, either through one incision or through natural orifices such as down the mouth. In addition, there's new technologies such as putting sleeves inside the GI tract to segregate the food away from the digestive juices, neuromodulation, applying a small electrical current to part of the GI tract to either stimulate a normal physiologic response or block a normal physiologic response. There's all sorts of wonderful things being developed so that the future is going to be even more exciting than what we just went through with the minimally invasive surgery.
What were the key components of this year's meeting?
Well, emphasis again on the near miraculous improvements we see with diabetes when we do surgery that in the past had been considered mostly for weight loss, that the improvement in diabetes is durable and can last for many years, but if patients gain weight back, they could actually have a recurrence of their diabetes. There has also been papers presented about outcomes to show that the overall mortality for the operations is 1 in 1,000, which is dramatically better than it was a few decades ago. And in fact, for the complex operations being performed on relatively complex patients, the 1 in 1,000 is the same risk as healthier people undergoing gallbladder surgery.
Wow. Can you tell me if there's any new information on access to surgery for patients that may want surgery?
I'm not sure of any new information, but the trend is for the healthcare insurance companies to actually try to tighten up or restrict access, solely because so many people are coming forward now for surgery because, one, they qualify because it's the epidemic of obesity, but two, because they now are willing to have these surgeries because of the good results and the low risk. And insurance companies and third-party payers are reacting by trying to slow that down. And in doing so, they're placing barriers to patients, such as mandatory 6-month diet programs, or they have to demonstrate that they were morbidly obese for 5 consecutive years, things that have never been shown to matter, but an opportunity to knock a few people off here and there who then don't qualify or get frustrated and give up. My suggestion is that they continue to fight, that they don't give up, that they provide all the appropriate documentation, that if necessary they appeal, and many times a rejected case may get overturned on appeal. And lastly, because it is their health and this is serious, to seek legal counsel. And there are attorneys who specialize in insurance denials and insurance restrictions, and they may be able to get it overturned that way. Or if they do have the option, switching to an insurance company that is more favorable. If our patients put up the same protesting that breast cancer patients and HIV patients put up, we would ultimately win. But our population tend to be a little more passive for many reasons. But if we can energize them and get them to really get a fire in their belly, we might be able to pressure change.
I think that's awesome. Thank you again so
Okay.
much.
It's a
Thank you.
pleasure.
Thank you.